And I'd like to commend Sinn Féin on this very important motion in relation to public health. And Minister, there's no doubt there is deficits in particularly in public health across the country. And obviously some areas are worse than others. And obviously there's mitigating circumstances why there are kind of deficits, and that can go down to lack of recruitment, retention, and obviously a big issue around keeping people in the health service is, you know, price of houses, paying conditions in the workplace. So these are huge factors in relation to filling posts in our health service. And obviously across the country there is shortage of GPs, and there's enormous waiting list just to see a GP, which never really happened until maybe 6-7 years ago, and there's obviously circumstances why that's happening, and so forth. But I just want to bring to your attention a particular issue around Dublin Midwest, and I'm guessing this is not probably just an isolated issue around, and this is an issue around public health nurses. You have quite an astonishing situation in parts of Dublin Midwest, particularly Lucan and Rathcoole and Newcastle, where there's no public health nurses whatsoever. None. Now, a public health nurse is hugely important, not only to kind of infants' health, but also kind of the elderly. And I got a response from the HSE in relation to why there's no public health nurses, particularly in Dublin Midwest. And they obviously say, like, it is down to recruitment. But even more worrying is that they try to recruit a lot of student public health nurses, and to date they haven't recruited zero. And that is extremely worrying, that student nurses that go into public health nursing don't see kind of, I suppose, a role in the public health system, and that is hugely kind of worrying. Because this is having a knock-on effect where mothers are contacting public representatives in Dublin Midwest, are saying, look, we can't get access to public health nurses for their children. And public health nurses are hugely important for developmental checks. So not having them is very, very kind of worrying. So it's kind of incredulous that we don't have this service, and particularly in Dublin Midwest. And I'm guessing that this is probably the same situation in particular different parts of Ireland. So it's important that, you know, the basics, and I think the basics is a public health nurse, because when I remember while I was young, and I remember my mother bringing me to the public health nurse, and that would, you know, you would have at least 4 to 5 checks before the age of 5. And now for some parents, there's none, literally none. No, I really think that is very, very worrying, Minister. As I said, this is having a knock-on effect, because if you can't recruit student nurses into a role because of all sorts of circumstances, then that's very deeply, deeply worrying, and hopefully this gap can be plugged really, really quickly. Thank you.